Good evening, everyone. Eldrigu Namaskara. Welcome everyone to Optima Life. This is our monthly program where we deal with common health topics. We call renowned experts and we discuss with them common topics. And today we have a very unique discussion because it is relevant to all of us. From typing all days and swiping endlessly on our phones, our hands work overtime. Uh, but sometimes we also have a lot of problems with our hands. A lot of people suffer from common issues which affect their day-to-day activities. To discuss our hand pains and what our hands are trying to tell us, we have with us a renowned hand expert, hand surgeon and nerve surgeon, Dr. Kishan Rao, who's a consultant hand surgeon at Bhagwan Mahavir Jain Hospital and Jayanagar Orthopedic Center. Welcome, Dr. Kishan. Thank you for joining us.
Thank you, Vikram, for your kind words.
Yes. So, welcome everyone to today's live session where we are going hand in hand with our expert to talk about keeping our hands healthy and pain-free. So, without wasting much time, we will start off with just to set the ball rolling. Dr. Kishan, what are some of the common hand conditions that you see in practice, which people come to you? Causes of hand pains.
You're able to see me, right?
Yes.
Okay. Yeah. As you're asking about the common hand problems, it is most of the time it is the clumsiness in the hand. What you call it is difficulty into carrying out day-to-day activities, or suddenly when you are trying to use your hand for longer period, some kind of numbness or pain or something, just a sort of irritation. So that is what they usually come up with, or many of the times it is a deformity, some kind of deformities in the hand with which they represent to hand surgery OPD.
Okay. So, what are the typical symptoms that indicate that this problem needs attention, medical attention? A patient with these symptoms should go to a doctor.
So in my perspective, like if there is anything which is bothering your day-to-day activities, or if it is affecting your vocational activities, I think it is the time you should visit any consultant, especially the hand surgery consultants, especially in case if it is worsening. If there is some, many of the times because of regular use, hand use, so some pain on and off it comes. And I don't think for that you need to consult. If it is bothering and if it is persisting and if it is increasing, that is the time you should definitely visit a hand surgeon.
Okay.
Or for that matter, any orthopedic surgeon or rheumatologist.
Yes. Thank you, Dr. Kishan, for throwing light on this. We will talk about a few common conditions now, which I think many patients face. Out of which, one of which I was looking up was carpal tunnel syndrome, which I think you see a lot of patients with carpal tunnel syndrome. Uh, can you just elaborate or uh, let us know what is this carpal tunnel syndrome and who are the patients at discussed? ಈ ಕಾರ್ಪಲ್ ಟನಲ್ ಸಿಂಡ್ರೋಮ್ ಅಂದ್ರೆ ಏನು ಅಂಡ್ ಯಾರ್ ಪೇಷಂಟ್ಸ್ಗೆ ಈ ತೊಂದರೆ ಬರುತ್ತೆ?
Yeah. See, carpal tunnel is one of those commonest problem which we encounter like in a routine basis. They are the one who has got the maximum attendees in a hand surgery OPD, um, other than aches and pains. So carpal tunnel, we also called it as it's a tunnel basically formed by 8 carpal bones and also the transverse carpal ligament. ಏನಾಗುತ್ತೆ ಅದರಲ್ಲಿ, when we have a nerve which is entering into the tunnel gets compressed. See, tunnel is basically, it is a fixed size, like volume is fixed. Either the contents of the tunnel will increase or the size of the tunnel itself will decrease, which eventually causes compression of the median nerve, which is the most commonest nerve getting compressed. So these things can happen because in our hand there are multiple tunnels. Even include, if you see, there are multiple pulleys in our fingers. So the carpal tunnel which is coming at this area, and there are multiple tunnels over here also. So whenever there is an increase in size is the tendons, that the tunnel becomes tight. And as you all know, ದ ಮೀಡಿಯನ್ ನರ್ವ್ ಅಂದ್ರೆ ನರ್ವ್ ಅಂದ್ರೆ ಏನು ಹೇಳ್ತೀವಿ, ಅದು ತುಂಬಾ ಸಾಫ್ಟ್ ಆಗಿರುತ್ತೆ ಕಂಪೇರ್ಡ್ ಟು ಟೆಂಡನ್ಸ್. ಸೊ ದೇರ್ ಆರ್ 9 tendons which passes through this tunnel and only one nerve. So the nerve being the softer compared to the tendons, it gets compressed easily. It's as good as saying that when there is a sponge and there are fibers, those fibers will start compressing the sponge than getting compressed by itself. So that eventually causes the clumsiness of the hand. So that is what is carpal tunnel. And the symptoms in carpal tunnel can vary. So it can vary from a minimal some numbness in the fingertips to severe kind where there is you're not able to sleep also. And sometimes it can even go to an extent that you're not able to hold a grip a glass of water. Suddenly the glass of water starts falling from your hand, unable to lift a weight. So these are the symptoms ranges from very mild or to the severe. And it need not be that it should start with very mild symptoms. Sometimes it can start with the very severe symptoms itself. So the degree of variation of symptoms varies. And most of the small commonest symptoms what the patients present is the numbness in the fingers, or sometimes the clumsiness of the hand, like difficulty in holding the thing. Suddenly they are not able to appreciate the hot or cold. Or the third most important is the pain during evening time, which is the commonest symptoms for this carpal tunnel syndrome.
Okay. So, Dr. Kishan, you told me about what is carpal tunnel and what are the common symptoms which patient present. But what causes this carpal tunnel? What are the common causes which lead to this problem where you can have clumsiness of the hand or numbness of the hand, or, as you said, pain during the evening time in the hands?
Yeah, as I already stated, so the tunnel is fixed. So you can consider like you are having a jar of 1 liter jar, and and you have 1 liter of water. Okay.
Okay.
So you fill it up to the brim, right? So it will match each other. And if you try to add some more water, like if you take 100 ml extra, what will happen? You have to fit into that vessel, right? So the things will start becoming tight inside. Or if you have the same container, if it has fallen down and there is a dent in the container and the dent goes inside, and you try to pour again 1 liter of water, which may not contain that 1 liter of water, it may contain only 900. Again, the 900 ml of water will start, because it is a closed container. So what happens? The pressure starts increasing. So if you apply the same thing, the tunnel, the size is, the volume is same. If the tunnel, as I already mentioned, if the volume increases because of the tenosynovitis, there are so many causes for it. Which causes tenosynovitis, like there is infective or inflammatory. Majority of the time it is idiopathic also. So if you go by inflammatory or idiopathic, this thing it can be secondary to diabetes or metabolic disorders like thyroid problems, or if you have especially in pregnancy, lactation period, or if there is a recent injury to the tendon or to the hand. These are the things where the content size increases. If there was an old injury like distal radius fractures, you had a fracture some 3 years 4 years back, or it was fracture and there was a plating was done, where it can induce the tenosynovitis, and the itself can reduce the size of the tunnel. So these are the things which can cause carpal tunnel syndrome. But what we see in our regular population is mainly because of diabetes or hypothyroid or hyperuricemia, or sometimes, though it comes as a lower order, or sometimes it is just idiopathic. It need not have any reason. It's just because of repetitive motion, especially if you see in Bangalore, it is more of a IT crowd. So it is repetitive injuries with more of their work pattern and typing.
So now carpal tunnel, you said that there can be varied causes. Is it more common in women or a particular age group, or is it all across? You see in all age groups and both genders.
Yeah, it is more frequently seen in females. Hello. Yeah.
Yes,
Am I
yes,
audible?
we can hear you. Yes, yes.
Yeah, it is more frequently seen in females. Just the fact it is because it is not just because of female this thing preponderant, because the pregnancy, the lactation, the hypothyroidism is all most commonly seen in females compared to the males. That is why even the carpal tunnel this thing incidence also increases more with the female than compared to the males.
Okay. Now, how do we diagnose this condition? What ways you can confirm that the patient has carpal tunnel syndrome?
Yeah, this is more of a clinical diagnosis, which can be confirmed with the diagnostic procedures. Mainly, we try to see the sensation part of the, especially these radial three fingers, because the median nerve supplies these radial three fingers and the half of the ring finger, and your little finger will be usually. So we try to see the sensation. We also try to see the muscle bulk, because many times by the time they present, because to us they would have gone from mild from moderate to severe carpal tunnel. So then in that case, even there will be subtle loss of the muscle bulk over the hypothenar region, which is basically supplied by that is why they start feeling that the reduced strength holding a glass or this thing, especially when women trying to comb or dress themselves on their back, button themselves. So these are the commonest things what they have. So we try to see these things, and once we see that if this is there, if there is any other symptoms are there, signs are there, like you know uh, dryness. Sometimes
Okay.
they can present with the dryness of these three fingers. So basically, we have sensory part, motor part, and autonomic part. The
Mhm.
autonomic part with the dryness of these fingers, the sensory, especially in women when they are working more in kitchen items and all. So there will be multiple cracks in their pulp
Mm.
area, and they'll
Okay.
be very rough compared to the little finger. That is also one of the clinical sign what we look for, and lots of sweating. And then we see the strength. We see the grips O sign. So where
Mm.
we could see whether the strength of the thinner muscle is adequate or not. Then there is some sign called as Tinel sign. We tap it on the median nerve zone. If the compression is from a longer period, what they will develop is when we tap on the wrist crease, they will start getting the tingling sensation in the fingertips. And Fallon's test. Fallon's test is the same provocative test where we do some bending of the wrist, so that what happens, we reduce the size of the tunnel, so that if there is already predisposing factor which is compressing the nerve, so it starts compressing more and more. And then what happens, the nerve symptoms reappears, because that is why the majority of the women will complain, because from morning till evening, that is why the evening symptoms are more common. They would have done their work from morning till evening. So and the evening time, that pressure builds up within the tunnel and causes those symptoms. So the same thing, we provocatively we do it with the Fallon's or Durkin's test. These are the clinical examination. But if you want to go by the uh, diagnostic this thing, then we have something called as monofilaments, Semes-Winston monofilaments, where we check the sensation of these three fingers. So we grade it. There are 5 different grades are there. So with the green being the 0.02 gram force, which is the normal force what we can see in our fingers. If there is any change in that is usually we depict with green color. When it changes to 2 gram force, that is with the blue color. So that is when we think, okay, there is significant amount of sensory disturbance. As I already mentioned, so one thing what which you need to understand, the nerve fiber is similar to our electric wire. I think everybody would have seen the electric wire. We have a wire which has got a black covering, and if you cut that covering, you will see that there are blue, green, red, multiple fibers running. Means colored wires are there. If you cut those wires, then you see the copper wires. Our nerve is same to same like that. So but only thing is we don't have that color coding. So when there is compression of this nerve, what happens, the nerve also needs oxygen and circulation for it to survive. because of the compression, that area will not get the nutrition. So what happens, as I already mentioned, if there is an wire with multiple cables running, red, blue, green, imagine there is a red color which gives supply to the sensation to the thumb or index finger, and the blue wire which gives strength to the motor power. So the nerve, the fiber which gets affected, which gets its less nutrition, will show the symptoms.
Okay.
So if there is a compression there, so that is how we get to know through the Semes Winston. And the same thing with the pinch meter, we see the grip strength, pinch strength. And electrodynamically, we can ask for nerve conduction study. As I already mentioned, the segment of the nerve which will be deprived of nutrition will not conduct the electricity with the same amount of speed as compared to the normal nerve. So that when the two electrodes are put, one here and one here, and then you see stimulate here and see for the time lag in stimulation to the response. If the time response increases, that means the conduction is decreased across the median nerve segment. That shows that median nerve is getting damaged. So thereby we can again seeing that we can give this thing as mild, moderate, and severe.
Sure, Dr.
And
Kishan.
there are other various other methods are also there, by doing an ultrasound therapy, ultrasound to see if there is a thickening or nerve compressing, and also to see the tenosynovitis. And very rarely we can use the MRI also to see these things.
So all in all, women especially who are diabetic or maybe pregnancy, hypothyroid, coming with clumsiness of the hand, ಕೈಕಾಲ್ numbness ಬರೋದು, ಕೈಕಲ್ಲಿಗೆ numbness ಬರೋದು, weakness ಬರೋದು. So I think they should be people who should consult and look for maybe suffering from carpal tunnel syndrome. And as Dr. Kishan pointed out, we can do certain tests to diagnose this condition by using nerve conduction or by ultrasound or MRI. Now once we have diagnosed, Dr. Kishan, treatment ಏನಿದೆ? What are the treatment options available? How effective are their options? Will patients get complete relief from their symptoms of numbness, weakness, etc.?
Okay. As I already mentioned, and you also quoted, Vikram, it depends on the cause. It's a cause. If there is a mechanical problem with severe restriction of, as I already mentioned, if there is a trauma with thickening of the carpal bones, or there is a distal radius fracture, malunited, which is compressing, then there is no role of any medical management. There we have to go really, either we take out the plate screws, or we have to release the carpal tunnel. And if it is inflammatory in the sense, whichever the things which causes the increase in size of the tendons, like diabetes, hypothyroid, or any inflammatory conditions, any kind of rheumatoid arthritis, so all these synovitis. So in that case, if there is a significant non-infective, as long as it is non-infective, if there is a lot of tenosynovitis is there, so we can always splint them, give analgesic, and you can gently mobilize the digits, because when you are mobilizing only the digits with restricting the wrist movement, so the tendons, the tenosynovial tissue tends to reduce. The thickening of the tenosynovial tissue starts reducing, thereby relieving the pressure on the median nerve. So
Okay.
we can always give splints for every 3 weeks. Only they can, especially, and majority what I see is, whenever I tell my patients to wear the splints, what they'll do, they'll wear it in the daytime and they'll remove it in the night time. ಆ ಥರ ಮಾಡಬಾರ್ದು. ಬೆಳಗ್ಗೆ ಇಂದ ಹಿಡಿದು ನೈಟಲ್ಲೂ ಹಾಕೋಬೇಕು. ನೈಟ್ ಇಸ್ ದ ಟೈಮ್. ರಾತ್ರಿ ಹಾಕೊಳ್ಳೋದ್ರಿಂದನೇ ಜಾಸ್ತಿ ಯೂಸ್ ಆಗೋದು, ಬಿಕಾಸ್ ಇಟ್ ಅವಾಯ್ಡ್ಸ್ ಅಬ್ನಾರ್ಮಲ್ ಪೋಸ್ಚರಿಂಗ್ ಆಫ್ ಯುವರ್ ರಿಸ್ಟ್, and which actually helps in if it is positioned in a normal thing, it helps in reducing the swelling of these tendons, and thereby relieves the pressure, and they will be all right. And all these analgesics also will help them in reducing the inflammation. And if it is because of this inflammatory causes, they may not get back the carpal tunnel again. But in case if all this medical management fails, with splinting, stretching of, there is something called a stretching of the carpal tunnel. Even if that fails, then there is only option left is to release the transverse carpal ligament. As I already mentioned, there are 4 bones which forms a cup like shape, and the lips of this cup is tied with the transverse carpal ligament. Once we release the carpal tunnel, the transverse carpal ligament, it opens up and the space increases, and the pressure over the median nerve gets relieved.
Sure, Dr. Kishan. Thank you so much for elaborating on the what is carpal tunnel syndrome, the ಕಾರಣಗಳೇನು, ಲಕ್ಷಣಗಳೇನು, what are the symptoms, and how do we diagnose and how do we treat. So definitely, I think many people will identify with this symptoms of carpal tunnel syndrome, and I'm sure they'll be able to consult their doctor and try and get this diagnosed and treated. Moving on to one more common condition which many patients come to clinic saying that uh, their fingers get stuck. So when they're able to fold the finger, but they open it suddenly. No, it gets one of the fingers gets stuck and it opens with a snap. Something which we call as trigger finger. I think many patients, especially because India is a diabetic capital, a lot of patients with diabetes or other causes also do come with these symptoms. Let's just talk about this trigger finger. What is this trigger finger? What causes the trigger finger?
As you already mentioned, trigger means things which snaps, suddenly triggers. It's like cut. Either it can trigger in extension or it can trigger in flexion. So ಇದಕ್ಕೆ ಇನ್ನೊಂದು ಹೆಸರು ಅಂದ್ರೆ ಸ್ಟಿನೋಸಿಂಗ್ tenosynovitis. As I already mentioned, already ನಾನು ಹೇಳಿದಾಗೆ ಡಯಾಬಿಟಿಸ್ ಇಂದ ಇರ್ಬೋದು, ಹೈಪೋಥೈರಾಯ್ಡ್ ಇಂದ ಇರ್ಬೋದು, ಅಥವಾ ಬೇರೆ ಯಾವ್ದಾದ್ರು ಕಾರಣಗಳಿಂದ ಇರ್ಬೋದು. ನಮ್ಮ ಕೈಯಲ್ಲಿ ಏನಿರುತ್ತೆ, see, as I already mentioned, carpal tunnel is also a kind of a pulley. There are multiple pulleys in the fingers. The most important pulleys are annular pulleys. Annular is like a round. Annular means round. So there are A1 to A5 pulleys are there. In that, the most commonly seen trigger finger is at the A1 pulley side. Either it can be in the thumb or it can be in the other digits. Normally, individuals 6 years, you can see more of trigger thumb in younger individuals. Other fingers, the index, middle, and ring and little fingers are seen most commonly in adults. ಏನಾಗುತ್ತೆ ಸ್ಟಿನೋಸಿಂಗ್ tenosynovitis ಅಂದ್ರೆ ಏನು? The same thing to pass through all the fingers. See, if you see this, we bend, mix, so it is like a finger. Okay, imagine if we don't have pulleys, the tendons will start coming out and it will start bowing like a bow and arrow, where you have a bigger this thing and the thread which starts pulling it like this. So you will develop deformity. So for that reason we have pulleys. Pulleys it has to pass through closer to the bone, and then you have efficient finger flexion extension. Stenosing tenosynovitis because of thickening. Imagine this is the pulley, A1 pulley like that, and you have the tendons which is passing through that. So you see that my knuckle, it is little thick. Now imagine that it is become, your tendon has swollen and you are trying to straighten your finger. So it starts stuck at the pulley side. So initial stage it gets stuck, but because you are putting more force, it just snaps to that other side. So the pull in the ee kade and aa kade cross at takshana, it will snap. So that is why you get that trigger feeling. Again, it has got 4 types. Type 1, 2, 3, 4 ಅಂತ ಹೇಳ್ತೀವಿ. 4. 1 ಅಂದ್ರೆ when it is basic minimum, when you feel touch the pulley site is there at your distal palmar crease. ನಮ್ಗೆ ಏನು ಇಲ್ಲಿ ಹಸ್ತರೇಖೆ ಕಾಣ್ತಾ ಇದೆಯಲ್ಲ, ಕೆಳಗಿದೆ ಬೆರಳಿನ ಕೆಳಗಿರೋ ಹಸ್ತರೇಖೆ ಇದೆಯಲ್ಲ, ಅಲ್ಲಿ ಮೈಲ್ಡ್ ಆಗಿ ಟೆಂಡರ್ನೆಸ್ ಬಂದ್ರೆ, ಓಕೆ, ಸೊ ದಟ್ ಇಸ್ ಟೈಪ್ 1. ಟೈಪ್ 2 ಅಲ್ಲಿ ನಿಮ್ಗೆ ಫೀಲ್ ಆಗತ್ತೆ, you start feeling it, tuck, it comes, then it goes without much of this thing, but it happens. Then 3 ಅಲ್ಲಿ it gets stuck, then you have to release it. So ಅದರಲ್ಲಿ ಏನಾಗುತ್ತೆ, ಕೆಲವರಲ್ಲಿ ಸ್ಟಕ್ ಆಗುತ್ತೆ, ಬೆಂಡ ಇದ್ದಾಗ ಸ್ಟಕ್ ಆಗುತ್ತೆ ಬಿಕಾಸ್ ಯುವರ್ ಟೆಂಡನ್ ವುಡ್ ಹವ್ ಸ್ವೋಲನ್ ಮಚ್ ಮೋರ್ ಪ್ರಾಕ್ಸಿಮಲ್ ಟು ದ ಪುಲ್ಲಿ. ಈ ತರ ಸ್ಟಕ್ ಆದಾಗ ನೀವು ಈ ತರ ಎಳೆದ ತಕ್ಷಣ ಅದು ಕ್ರಾಸ್ ಆಗುತ್ತೆ. ಇನ್ ಕೆಲವ್ರಿಗೆ ಏನಾಗುತ್ತೆ, ಸ್ಟ್ರೈಟ್ ಮಾಡಿರ್ತಾರೆ, ಅಲ್ಲಿ ಸ್ಟಕ್ ಆಗುತ್ತೆ, ಬೆಂಡ್ ಮಾಡಕ್ಕಾಗಲ್ಲ. ಸೊ ದಟ್ ಈಸ್ ಎ ಎಕ್ಸ್ಟೆನ್ಷನ್ ಟೈಪ್ ಆಫ್ ವಿಚ್ ಇಸ್ ಎ ಲಿಟಲ್ ರೇರ್ ಕಂಪೇರ್ಡ್ ಟು ಫ್ಲೆಕ್ಷನ್ ಟೈಪ್. ಬೆಂಡ್ ಆಗಿ ಸ್ಟಕ್ ಆಗೋದಕ್ಕೆ ಫ್ಲೆಕ್ಷನ್ ಟೈಪ್ ಅಂತೀವಿ, ಸ್ಟ್ರೈಟ್ ಇದ್ದು ಸ್ಟಕ್ ಆಗೋದಕ್ಕೆ ನಾವು ಎಕ್ಸ್ಟೆನ್ಷನ್ ಟೈಪ್ ಅಂತೀವಿ. ಅಂದ್ರೆ ಅದು ಟೈಪ್ 3B, ಫ್ಲೆಕ್ಷನ್ ಅಲ್ಲಿ ಇದ್ರೆ ಟೈಪ್ 3A ಅಂತ ಹೇಳ್ತೀವಿ. ಫೋರ್ತ್ ಒನ್, ಸಮಟೈಮ್ಸ್ ವೆನ್ ವಿ ನೆಗ್ಲೆಕ್ಟ್, ಏನೋ ಆಗಲ್ಲ ಆಗತ್ತೆ ಬಿಟ್ಬಿಡ್ತೀವಿ, then it gets permanently stuck. It will be well adherent, will not be able to straighten. That is called as type 4 trigger. So is tenosynovitis in the dappa agi stuck agodakkene ನಾವು trigger ಅಂತ ಹೇಳೋದು.
Fine, Dr. Kishan. So very well explained what is trigger finger. I think all of us really understood this. But how do we treat this? Is this condition treatable? How do we improve the movement of the fingers in somebody has trigger finger?
And definitely, it is a treatable condition only. So medical management ಅಂತ ಹೋದ್ರೆ, as I already mentioned, ಇದೆಲ್ಲ ಆಗೋದು ಏನಕ್ಕೆ? There is a size mismatch because of the size of the pulley is constant, whereas the size of the tendon increases. So then it starts getting stuck and causes trigger. So what do? You start giving rest by splinting. And you can use ultrasound therapy. ಈ ಫಿಸಿಯೋಥೆರಪಿ ಹೋದ್ರೆ ಅಲ್ಟ್ರಾಸೌಂಡ್ ಅಂತ ಕೊಡ್ತಾರೆ. ಸೊ ಏನಾಗುತ್ತೆ, ಅಲ್ಟ್ರಾಸೌಂಡ್ ಕೊಡೋದ್ರಿಂದ ಬಿಕಾಸ್ ಆಫ್ ಡೀಪರ್ ಟೆಂಡನ್ ಟಿಶ್ಯೂ ಮಸಾಜ್, ಆ ಸ್ವೆಲ್ಲಿಂಗ್ ಟೆಂಡನ್ ಮೇಲೆ ಇರುವಂತ ಸ್ವೆಲ್ಲಿಂಗ್ ಕಡಿಮೆ ಆಗುತ್ತೆ. ಕಡಿಮೆ ಆದಾಗ ಏನಾಗುತ್ತೆ, ಆ ಪುಲ್ಲಿಗೂ ಟೆಂಡನ್ಗೂ ಮ್ಯಾಚ್ ಆದಾಗ ದೆನ್ ಯು ವಿಲ್ ಬಿಕಮ್ ಆಲ್ ರೈಟ್. ಸೊ ಮೆಜಾರಿಟಿ ಆಫ್ ದ ಪೇಷಂಟ್ಸ್ ವಿತ್ ಟ್ರಿಗರ್, ಆಲ್ಮೋಸ್ಟ್ ನನ್ನ ಪ್ರಾಕ್ಟೀಸ್ ಅಲ್ಲಿ ಅರೌಂಡ್ 95%, 90 to 95% with trigger. When we 90% you can see. So ultrasound therapy with analgesics ಮತ್ತೆ proper splinting ಕೊಡೋದ್ರಿಂದ ಏನಾಗುತ್ತೆ, the swelling will reduce and it will go back to normal, provided if you are a diabetic or if you are a thyroid or if you have any inflammatory conditions, you treat that also. ಅದನ್ನ ಟ್ರೀಟ್ಮೆಂಟ್ ಕೊಡದಲ್ಲೇ ಇದನ್ನ ಮಾತ್ರ ಮಾಡಕ್ ಹೋದ್ರೆ then it may not correct. So concomitant treatment of the primary cause of diabetes, thyroid or any inflammatory condition should be treated. And then automatically your trigger finger also becomes normal. In some individuals it may not reduce. ಆವಾಗ ಏನ್ ಮಾಡ್ತಾರೆ, there is something called as intralesional steroid injection. ಅದು ಯಾವಾಗ there is significant amount of tenosynovial thickening idre, inflammatory idre, that too transient. If it is thick and non-reducible, then that steroid injection also will not help. But I generally avoid any kind of infiltratory injection to the thumb. Either I do conservative with splinting, ultrasound therapy. Injections I don't use advise for thumb because it is little complicated, and we have seen a couple of tendon injuries also with the injection. But for other fingers, yes, it gives good results. And late, that 5% of the individuals whose conservative treatment has failed, ಯಾರಿಗೆ ಯಾವುದು ವರ್ಕ್ ಆಗಿಲ್ವೋ, then we do something called as pulley release. It is a daycare procedure, just a 5 to 10 minutes procedure, where we wear that A1 pulley which is tight, we just release it off, and which gives permanent relief. And moreover, trigger finger many times ಏನಾಗುತ್ತೆ, ಇಲ್ಲಿ ಮಾತ್ರ ಪೇನು ಅಂತ ಅನ್ಕೊಂಡು ಬರ್ತಾರೆ, but many times you might see that pain will be there in the PAP joint on the extensor side, because your extensors are very thin tendons. Especially this extension of the PAP is done by the lumbricals. There are some smaller muscles of the hand. ಅದು ಏನಾಗುತ್ತೆ, ಅದು ಓವರ್ ವರ್ಕ್ ಆಗ್ತಾ ಇರುತ್ತೆ. though it is little bit of pain on this, majority of the times ಏನಾಗ್ತಾ ಇರುತ್ತೆ, ಇಲ್ಲಿ ನಕ್ಕಲ್ ಹತ್ರ ಪೇನ್ ಬರ್ತಾ ಇರುತ್ತೆ. So many of the patients, because this pain will be more than this, we will be concentrating more on the PAP joint. Actually ಅದು ಇಲ್ಲಿರೋದಿಲ್ಲ, it will be the trigger fingers.
Excellent, Dr. Kishan. I think very interesting discussion about trigger finger, the causes and the treatment aspects. We are actually running short of time. Quickly, can we discuss about the one more third condition that is called as Quervain tenosynovitis, where many people, especially now because of repetitive use, they come with pain on this part of the thumb aspect of the wrist, and they are very difficult, especially women. We see very commonly coming with this sort of symptoms. What is this condition? What is the causes? And how do we manage this? Quickly, if we can discuss about
Yeah.
this.
As I already mentioned about trigger finger or carpal tunnel, the same thing is applicable for the dequerence also. The conditions, the causes, everything is almost the same. Only thing is this can be because of the repetitive injuries, especially the racket sports. So those who play the racket sports, that is like tennis, table tennis, all they are more prone. And desktop job people who have got an odd position of holding their mouse. So they are the one who come with dequerence tenosynovitis. The one interesting fact about the dequerence is it has got, as you know, in this extensor side there are 6 tunnels, but this first tunnel, the tunnel above the radius, which where we call it as dequerence, means the tendons, same thing like trigger, what we saw, what we discussed over the palmar aspect. This is the same thing. This is the extensor tendon starts getting stuck at the first pulley, which is formed by the extensor compartment. What happens in many of the individuals, this APL tendon, instead of having one single tendon, they will be 2 or 3. Many times I have seen that in one single tunnel, normally we have one APL tendon and one EPB tendon which moves the thumb extension. So 2 tendons are supposed to be there. In these cases, what happens, there are 4 tendons, which itself is, it has adjusted to that compromised a little bit of change in size will start triggering. And rest is the same thing, whether it is thyroid or the diabetes or this thing or repetitive trauma. Here also the treatment remains the same. Ultrasound therapy, you splint the thumb, you avoid doing the adduction mobility like this way. So the thumb, if it is going more towards this, your pain will start, it will start shooting across the tunnel. Sometimes what happens, this tunnel has got one more sub tunnel for the EPB. So the APL will be in one tunnel and EPB will be hidden in another tunnel beneath that. That is one of the cause for the failures of dequerence release. Majority of the times what happens, you would have just done the even the ultrasound therapy will not reach the deeper tunnel and still the pain will be persisting. That is the time when the pain extends up to this joint, to the MCP joint, then we should always look for the subset of tunnel which is within the tunnel. It is both AP and EP. Again, 95% of the time, ultrasound and sprinting helps in relieving this problem. And workplace modification. Don't stress too much, reduce the activities on that. If not, then the small daycare procedure where we just release the first extensor compartment.
Thank you, Dr. Kishan. I think we had a very quick discussion about of all the 3 conditions. There are some questions by the audience. I'll just take them one by one. Chaitra is asking, are there any alternative therapies in home which can prevent hand pain? Something which they can do at home to, or something lifestyle changes to prevent some of these conditions? Are there some hacks like that or something which the ladies especially can do?
That's what hand pain, if you are getting this thing, as I already mentioned in my talk earlier itself, minimal pain here and there, you don't need to consult a doctor. If some activities, then you should avoid those activities. But in spite of changing your lifestyle, and it is, you should consult, take the advice further, what needs to be done.
Yeah, so it's a very important point. So you should not ignore it. You should consult an appropriate specialist on these conditions, and so that it's properly diagnosed. And because some of them most of them are, almost all of them are easily treated once we diagnose them appropriately. So one last question: what are the warning signs? Again, I think we dealt with this. What are the warning signs that one should seek attention, medical attention for hand pain? If you can just, for the benefit of patients, just go through that once again.
Yeah, if there is any problem which is affecting your day-to-day activities, you should never ignore. And if there is any condition in the hand which you think it is causing further deterioration or the deformities, like the trigger finger or redupitrans, where the slowly the deformity starts as a mild problem and then it keeps worsening, or if you are seeing that your strength of the hand is decreasing, or if there is anything which is suddenly increasing in size, so you should definitely not ignore it, and you should consult your expert doctor.
Thank you, Dr. Kishan. I think we have overshooted our time. It was a very wonderful discussion regarding these common conditions. I think everybody will be benefited by this, all the audiences. Thank you so much for taking time with us and having discussion. I'm sure there are many more questions. We will take it up with Dr. Kishan and we'll put it up with the chat. Thank you again. Thank you, audience, for being us. We had a few, I think, network issues. Thank you for bearing with us. With this, we'll wind up this session. Hope to see you next month again with the more interesting discussions. Thank you all. Good night. Thank you, Dr. Kishan.
Thank you. Thank you. Thank you. Thank you.